Pneumonia is inflammation of the lungs, usually caused by an infection caused by a bacterial, viral, or fungal infection. Pneumonia causes your lung tissue to swell and can cause fluid output in your lungs. Pneumonia can be spread in several ways. The viruses and bacteria that are commonly found in shy nose or throat can infect lungs if they are inhaled. They may also spread via airborne droplets for a cough or sneezing. In addition, pneumonia may spread through blood, especially during shortly after birth. Different pathogens cause pneumonia, and the ways they are transmitted, as it is of critical importance for treatment and prevention. But before anything else, is screening disease. If you have a risk of developing the disease, for example, being close to a patient who had the disease, try new aids for initial screening.
Hi, so next I will talk about the characteristics of the patients who will benefit from this app or our app. You know that? Actually, our app is responsible for screening and assessing the risk of pneumonia. So everyone is suitable and can use this app, be it women, men, boys, girls, people of genders and ages, especially people who are at risk of getting pneumonia easily. You know that, such as young children who are under 2 years old, the elderly, who over 65 years old, people with low immunity, smoker, or people with chronic illnesses such as diabetes, asthma, or something like that. So this is the characteristic of the patient who will benefit from our app. Thank you.
I'm going to talk about what are the main symptoms of the condition the app can help with. Our app helps to assess early symptoms and monitor those at risk for pneumonia. Our application will be able to measure vital signs such as body temperature, respiratory rate, pulse, and the app has questionnaire for cough, phlegm, sweating, chill, and fatigue, chest pain while breathing or from coughing, nausea, vomiting, or diarrhea. This will help you easily and effectively assess your symptoms.
When you have lung problems, if you're inconvenient to go to the hospital to check or are still unsure about the current symptoms, this application will be able to help you assess the severity of your symptoms detailedly. Let's see how this app works. First of all, when you press into the app, you have to log into the app system using Gmail, Facebook, or Apple ID to log in, or press register if you have never used this app before. After logging in, you must fill in your personal information, including your name, surname, age, date of birth, chronic disease, history of illness in the past for both you and your family. The next step is to measure vital signs yourself and record them every 4 hours. There is temperature, pulse, respirations, and finally oxygen saturation that you can use a stopwatch to measure. The app will tell you the correct measurement method and the time it takes to measure. Importantly, the measurement of vital sign is an indication of the functioning of the body. If there is a change, it indicates that the health condition has changed.
When you have finished entering your health information, proceed to the checklist. If you have symptoms that match the checklist, if you have a cough with sputum, chest pain when coughing, difficulty breathing, fever, chills, or weariness, our app will process your underlying vital sign and symptom information. The outcome will be shown as a percentage. Number 1 is, if you get less than 50%, the app will advise you to wear a mask, stay away from other people in the house, or go to the pharmacy to acquire medicine. Number 2. If you get more than 50%, the app will advise you to go to doctor as soon as possible to get the diagnosis. However, if you are under the age of 2, above the age of 65, have a weakened immune system, and are getting chemotherapy or immunotherapy medications, if you have at least 3 symptoms, you should consult a doctor straight away. The final step is save your data in the system, and will notify you again 4 hours later to follow up till your symptoms have returned to normal.
Other applications have something special than other applications that users should know. 1. We can accurately and quickly tell the risk level of pneumonia. Just fill out the risk scanning form in the application. 2. Our application is easy to use, convenient, even without medical knowledge. It can be easily understood. 3. Our application is created by a nurse who specializes in pneumonia.
Today I will ask the question, when do you recommend patients use this app and why? This app is for patients who have been diagnosed with pneumonia, have returned from hospital, and have been successful test. So if you need some convenience along with safety, this app will make you best. In addition to detecting the basic signs of pneumonia, when your vital signs are abnormal, such as decreased oxygen saturation, arrhythmia, or high blood pressure, etc. When this app will alert you to the hospital immediately. Importantly, UGP can monitor your symptoms from hospital in real time, even if you are at home in the absence of worrisome conditions. That means you may not need to visit the hospital as often. The most important, you can download this app for free at the App Store and Play Store, and don't forget to use it for your digital watch. And finally,